The vitamin D blood test isn't totally reliable. The blood test is looking at something called 25-hydroxyvitamin D, and that is an intermediate between the vitamin D that we consume or receive from the sunlight and the active form of vitamin D. If you test that vitamin D, the level is entirely dependent on what happened in the past 24 hours. And that level is fluctuating pretty rapidly, so it's really hard to tell from that level if you have a stable, adequate level of vitamin D in your body. So that one's out. Next, it sounds like testing the active form of vitamin D would be the best, but there's some major issues with that test as well. In the event of a vitamin D deficiency, the body has compensatory mechanisms that actually temporarily increase the level of the active vitamin D. And again, depending on when that level is tested, it's possible to have elevated levels of active vitamin D when you're actually vitamin D deficient. So again, that's not a really helpful blood test. And that leaves the form in the middle, 25-hydroxyvitamin D. This one typically remains pretty consistent because it stays in the bloodstream for a pretty long time. But it's still potentially not a reliable test because looking at just that one aspect of the vitamin D in this long string of metabolites doesn't necessarily mean we know exactly what's happening. It is entirely possible to be vitamin D deficient, but your 25-hydroxyvitamin D levels are elevated, or also they can be really low. And it depends on the multiple factors that are involved in the metabolic process of that vitamin D. That first biochemical reaction happens in the liver and requires magnesium, among some other things. So if there's liver issues or low magnesium levels, you're not going to have adequate 25-hydroxyvitamin D levels. And the biochemical reaction that takes 25-hydroxyvitamin D into the active form of vitamin D happens in the kidney and also requires magnesium. And it's entirely possible for either of those biochemical reactions to occur faster or slower than we might expect. And in either case, that can mean that 25-hydroxyvitamin D, that blood level of vitamin D that you're testing, might not be super accurate. However, it's definitely the best thing we have available, so it's a great place to start.